Osteoarthritis by Aaron Smith. Pathophysiology. Osteoarthritis is one of the most common degenerative joint diseases affecting millions of Americans in the United States. It affects over 32.5 million U.S. adults. It is one of the most common causes of chronic disability among older adults and can affect any joint in the body, especially the hands, knees, and hips. Osteoarthritis can be classified as idiopathic, having no identifiable cause, and can further be identified as localized or generalized. Primary or idiopathic osteoarthritis has no prior event or disease related to it. Secondary osteoarthritis results from previous joint injury or inflammatory disease. The pathophysiology of this disease is due to the failure of the synovial joint, including the loss of articular cartilage, osteophyte formation, meniscal damage, ligamentous laxity, subchondral bone changes, and cartilage perfusion. Normal joint versus osteoarthritis. Osteoarthritis may be thought of as the result of many factors that, when combined, predispose the patient to the disease. For example, mechanical injury. Osteoarthritis via mechanical injury from an injury of the articular cartilage, subchondral bone, and synovium. Chondrocyte responses are factors that initiate a chondrocyte response, including previous joint damage, genetic and hormonal factors, and others. The resulting damage predisposes to damage further as the chondrocyte is triggered to response again. Stages of osteoarthritis. Osteoarthritis stage 1. Minimum disruption. There is already 10% cartilage loss. Osteoarthritis stage 2. Joint space narrowing. The cartilage begins to break down, and the occurrence of osteophytes begins. Osteoarthritis stage 3. Moderate joint space reduction. There are now gaps in the cartilage and can expand until they reach the bone. Osteoarthritis stage 4. Joint space is greatly reduced. 60% of the cartilage is already lost. Large osteophytes are present. Osteoarthritis versus rheumatoid arthritis. Arthritis can be difficult to differentiate from rheumatoid arthritis. There are key factors that differentiate the two. Osteoarthritis joint stiffness usually lasts less than 30 minutes. Rheumatoid arthritis joint stiffness typically lasts greater than 1 hour. In osteoarthritis, the joints will present with reduced range of motion and crepitus. The X-ray of the joint will show a presence of osteophytes and joint space narrowing. Pharmacologic management and review. Mild osteoarthritis should begin with regular exercise and encouragement of weight loss. Consider prescribing physical therapy for supervised exercise. Wu and Robinson report that initially, acetaminophen should be prescribed and dosed at 650 milligrams 4 times per day to manage the joint pain. If this fails to control pain, NSAIDs can be added. Pharmacologic management and review continued. According to the FDA, acetaminophen should not exceed 3 grams per day. This medication can be very caustic to the liver. Signs of liver damage can include nausea, vomiting, or loss of appetite. Patient safety and education should be clear on doses during prescribing. Start NSAID therapy with over-the-counter ibuprofen or naproxen. These are considered second to acetaminophen because they can cause more gastrointestinal upset. Patients should be educated to take with food to prevent stomach ulcers. NSAIDs are contraindicated in patients who have a history or a current GI bleed. Add combination glucosamine and chondroitin for moderate to severe osteoarthritis. Reassess the patient in 3 months. If there is no change in pain, discontinue the glucosamine and chondroitin. Glucosamine is thought to stimulate cartilage production and enhance rebuilding of damaged cartilage. It should be taken at 1,500 milligrams per day. Glucosamine is contraindicated in pregnant women. The American College of Rheumatology does not have proven evidence of either glucosamine and chondroitin. Therefore, they do not recommend this medication for control and pain of inflammation of osteoarthritis. In severe osteoarthritis, consider prescribing opioid therapy such as tramadol. Monitor for dependence and abuse. Tramadol can increase a patient's risk of falls. Educate the patient to monitor their blood pressure and to stand slowly when taking the medication. Also encourage patients to remove any throw rugs to reduce the risk of falls. Non-pharmacologic management. Moderate intensity exercise, such as walking, swimming, biking, and yoga, are recommended for people diagnosed with osteoarthritis. The CDC recommends 150 minutes of light exercise per week. Heat is used to reduce the pain and can be applied over the joints. Weight reduction is strongly recommended for obese patients to avoid further damage to the cartilage. The patient should avoid joint overuse and rest the joints regularly. Devices such as splints and braces can be used to support inflamed joints. Vigorous exercise is not recommended for patients with osteoarthritis. Holistic management. Holistic management includes eating a diet high in anti-inflammatory foods such as tomatoes, fruits, nuts, leafy greens, and fatty fish such as salmon. Turmeric is an anti-inflammatory supplement that can be taken in powder form or capsule. Harvard Health also recommends acupuncture, acupressure, copper bracelets, and Tai Chi. Patient education. It is important for patients to understand what their role plays in their osteoarthritis. The patient can make a big impact on their pain level and the progression of their disease. Eating a healthy diet, committing to cessation of tobacco and alcohol, participating in low-impact exercise, eating an anti-inflammatory diet, and losing weight will all play a role in their self-management. Osteoarthritis can also negatively affect sleep patterns, leading to sleep disturbances and depression. The patient should be educated on monitoring for these symptoms and reporting them to their provider. Their socioeconomic status should be evaluated to determine if they have access to grocery stores to purchase healthy food. If they do not, other options should be explored. Scientific literature. According to the CDC, osteoarthritis is the most common form of arthritis. Some people call it degenerative joint disease or the wear and tear arthritis. It occurs most frequently in the hands, hips, and knees. With osteoarthritis, the cartilage within a joint begins to break down and the underlying bone begins to change. These changes usually develop slowly and get worse over time. Osteoarthritis can cause pain, stiffness, and swelling. In some cases, it also causes reduced function and disability. Some people are not able to work or complete daily tasks anymore. These simple avoidances can affect their mental health. We currently live in a world where the population is becoming increasingly overweight, obese, and sedentary. Mobashiri and Batt note that while obesity is a well-known risk factor for many chronic diseases, a lack of physical activity is also an independent risk factor, as in the numbers of hours spent being sedentary. Consequently, healthcare systems around the world are developing strategies trying to encourage health and wellness through increased levels of daily physical activity. In American Family Physician Journal, author Keith Sinusis explains that the treatment for osteoarthritis is patient-specific. Treatment includes non-pharmacologic, pharmacologic, complementary and alternative, and surgical treatment. Treatment should begin with the safest and least invasive therapies before proceeding to more invasive, expensive therapies. Sinusis recommended starting treatment with low-impact exercise, such as swimming, biking, and walking. Physical activity is essential for optimal health. It is acknowledged that increasing physical activity and reducing sedentary hours would go a long way to preserving both physical and mental health, and preventing increasing burden of long-term conditions. A Cochrane review of exercise for osteoarthritis of the knee concluded that land-based exercise can result in short-term reduction of pain and improvement in physical function. An additional Cochrane review of water-based exercise for the knee and hip osteoarthritis showed improvement, but the results were not as dramatic of those during the land-based exercise. In addition to exercise, Sinusis recommends prescribing acetaminophen for pain relief. NSAIDs can be added but are not the first-line therapy due to their high rate of gastrointestinal irritation. For a more holistic approach, the National Clinical Guidelines Center recommends eating an anti-inflammatory diet and taking glucosamine and chondroitin supplements. If exercise, first-line drug therapy, and natural approach are not enough, an opioid can be added. Opioids have a high rate of dependence and should be avoided if possible. Surgery should be reserved for patients whose symptoms have not responded to other treatments. The most effective surgery intervention is a total joint replacement with excellent patient outcomes following total joint replacements of the hips, knees, and shoulders.